Hello, everyone, and welcome to Health Law Talk presented by Shahardy Sherman Williams. Before we get started, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. We hope you enjoy this episode.
Good morning, everyone. Welcome to another edition of Health Law Talk here at Shahardy Sherman Williams. Conrad Meyer in the studio with
Rory Blina. Good morning, everyone.
Good morning. Good morning, Rory.
Morning.
How are you today?
Doing well. It's a Friday, so it's good. Things are going well.
People don't know this, but we actually try to record on Fridays.
Yes.
For
the following week.
Yes. Right. But today we came here bright and early. We're going to talk about something interesting, and something that I think it just sort of goes unnoticed.
Sure.
And it talks about the hidden costs of COVID.
Yes. Yeah. And there's so many different aspects and hidden costs involved. So we just thought this would just be more of a conversational podcast and talk about the hidden costs of COVID that you and I have experienced with our clients.
And we can start off, I would say that it's not just applicable to healthcare providers. We're talking about businesses in general and things like that. So with that being said, one of the obvious things when this pandemic first started, I know that from a supply chain side that the providers, the large system providers, some of them weren't prepared for the amount of PPE that was going to be needed to handle the pandemic.
Right. I think the biggest supply, right when this started, like you mentioned, was there was a run on the masks. That seemed to be the biggest thing. And then after that, it was, there was the hand sanitizers and the soaps. That seemed to be the big thing, at least here in New Orleans.
Well, disinfectant, Lysol,
yep.
Any disinfectant that was sprayed was out.
Yeah, we had a lot of local breweries here that luckily stepped up and they started, they switched out from making alcohol to making hand sanitizer with their ethanol. So it was a big, that seemed to be the big thing. And then it shifted over to some of the some other things such as like the floor markings where people should stand,
right.
The plexiglass,
the
signage was a big thing, putting up barriers between areas where there was a lot of people.
But when you look at it, when you go back to the beginning of the pandemic and you look at when we first started, you're looking at March, April 2020, May, in that first 3 months, okay, and you realized coincided with the messages from the government. Wear a mask, don't wear a mask. You don't need a mask. Wear one mask, two masks. Because when you first came out, it was, no, you don't need a mask. Now you need a mask.
Right. And it was very unclear what was a mask. Was it just a cloth? Was it
a cloth, a N95, or what does it matter?
Could it be just a bandana? There was a lot of confusion with what was a mask.
Yes. So my point was that I'm wondering if there was a coordinated message here that the Hospital Association, and I didn't know, I'm just thinking about this, was behind the scenes telling the government, don't tell them, no, it's okay, they don't need a mask because we're running out of masks.
I know that. I remember hearing that. I think it was around April and May. That was when I believe at least our governor said, don't try to purchase these N95s. We really need to save these for our healthcare workers.
Right.
And well, that's when everyone realized, well, we probably need these then because if they're using them, then we need them. But there was that message that buy something that was less because we don't have the supply at this point.
Right, and also, very quickly we realized, well, wait a minute, all the manufacturing for the masks, the disinfectants, and all these other PPE type things was overseas.
Correct. Right.
So we're like, well, wait a minute, we're not going to be able to get this anytime soon.
Right.
And so that was a big wake up
because they were fighting the same virus that we were.
That's correct.
And then for the people that were trying to generate it here, they shut down because they were having outbreaks or they were trying to be proactive and didn't want people in their factories.
And so we learned a lot of lessons from this.
We did, and there was a lot of the theme of today's show is the hidden cost of COVID-19. I think one of the biggest costs was being prepared. God forbid this happens again, but being prepared and the costs associated with having enough PPE for whatever business you're in. If this happens again, I think a lot of businesses never thought, okay, I need hand sanitizer stations. I don't need masks. I don't need plexiglass. There was just a lot of gyms needed to start cleaning a lot more and cleaning in between uses. Restaurants, they probably only wipe down their chairs and tables at the end of the night. Now they're doing it between every person, and they're printing out disposable menus. I mean, it trickles down to really every business. They had a huge just cost increase for trying to do things to slow the spread of this virus.
And I think I agree with that, 100% agree with that. I also think that if you look back to Katrina, we're in New Orleans, so we look back at Katrina.
Sure.
And after Katrina, every hospital in the New Orleans area that flooded, from downtown, Tulane Charity,
sure,
all those, it was emergency preparedness.
Right.
What do we need to do?
Backup power was the biggest priority then.
Absolutely. And so the problem was we need to have emergency preparedness. And there was a flood of CLEs and education programs with, all over in various sectors of the business about emergency preparedness.
And there was a push to move a lot of your imaging and critical care to higher floors in your building.
Right.
Yeah,
exactly. Yep. So now, that was lessons from Katrina that sort of systemically moved into the business sector in various forms.
Right.
Now we have the pandemic and lessons learned from that. So now we have the PPE, we've got the supply chain side. So if I'm materials management in a large system, what am I going to do to prepare myself where I'm stocking for my facilities, but not overstocking, but making sure that we have an adequate supply chain for our providers.
And you have to make sure that across all businesses that you're going to have to add and allocate money to that budget to where you're buying more towels, more cleaning supplies.
That's the cost.
And that's the cost. That's the cost. Every business, I would say, is now purchasing more cleaning supplies than they ever had, and they're having to allocate staff to clean. They're having to hire more cleaning, a cleaning company come in every night, or you see a lot of companies will have these kind of UV robots that go across, or they're bringing in companies to spray down their buildings every night, and they've got the little sticker on the door saying that they're clean and sanitized. That's a huge hidden cost of COVID is the materials and the cleaning.
And you got staffing too. So you might have to hire more people to scan, screen.
And that's what I wanted to segue right into is let's talk about the hidden costs. Let's talk about it on a personnel side. What have been the shift since this has occurred to staffing? Where have you seen that change?
I've seen, for example, points of entry now have been limited.
Sure.
So that they can scan. And now it's progressed because of the vaccine. So now we have various points of entry that before you would be able to go anywhere to get into a facility,
sure,
for example. Now you can only go in certain places where you show your vaccine your vaccine, proof of negative COVID test, or to be scanned for your current symptoms,
sure,
things like that. So you need personnel to man that. And actively monitor people who are coming egress out of your facility.
And I think another hidden cost, I was speaking with someone that's in hotel administration. She was explaining to me that they've had to double their support staff for cleaning. And it's not just the people that clean the rooms when you check out, because that's isolated to you. That really hasn't changed. But the people that are just kind of walking around and wiping down the check-in counter and cleaning the bathrooms. I mean, that's been and I'm sure on the hospital side, it's been the same thing. Hospitals are required to be, very clean by regulation, but I'm sure they've had to increase that as well.
I am sure the Environmental Services Department has had to really beef up their personnel and as well as their supplies.
Sure.
You're not going to get out around that.
No. And I think another big increase that you're seeing is businesses, and we go back to the hospital aspect of, when COVID hit, another hidden cost was they were having to pay for, we talk about cleaning, having to do more cleaning for clothing for their different providers. And another thing was childcare. The childcare is another hidden cost that was big with this. So they had to pay for during this emergency, which we're still under, they were allowed to pay for, childcare for their staff. And that's a huge hidden cost that I don't think that they were prepared to take on to keep their workers there during the thick of the pandemic.
So think about revenue generators for businesses, whether it's a facility or not.
Sure.
You got combined, maybe do you make revenue not only from seeing patients in the facility? So we've got elective procedures that were at a point shut down.
Right.
You've got only COVID patients, so you're losing your elective revenue. 6 feet social distancing, so the cafeteria is not going to be as packed as it usually is.
Right.
So you're losing that revenue, and I mean, especially even for say a business, say a restaurant. I mean, so it's almost like a perfect storm where you have less people because of the social distancing, more costs for personnel to monitor and adhere to, more costs for cleaning supplies and PPE. It's like a perfect storm during the pandemic.
It was really about, I would say, not for all businesses, but like you mentioned, the restaurant business, it had to have been a lose-lose for them. I mean, they're trying to do the right thing, and they were all trying to do what was required to stay open. But like you mentioned, they're having to increase their costs for, whether it be, paper menus or cleaning supplies. They're having to only at one point in Orleans Parish, it was, I think, a 25% capacity. Then we went to 50 and 75, but then still maintain that 6 feet of distance. So they have more costs. They've got less tables and, less people being allowed to come in. Like you said, it was the perfect storm.
And for the restaurants, for example, you're going to have to pass that cost on to survive. So, I mean, your food prices are getting higher, your menu prices are getting higher, but then at what point does the market bear and says, well, we're not going to pay $18, $20 for a hamburger for say, right? I'm just not going to do it. So then at what point, where's the equilibrium? And but see, with hospitals, with facilities, you don't get that choice because you're under payer contracts.
Right.
You can't pass the cost on because you're under contract.
Right. So you're taking a loss, or you're finding something to put it under, but it's really hard under the hospital model.
Absolutely. So on the provider side and in the healthcare industry, most of the providers or facilities are under contracts. And even the ones that aren't under contract, I mean, it's a small percentage as opposed to, I'd say, a majority of providers. So that you're stuck.
Right.
Who are you going to pass the cost on to?
Right. Now, one thing that's been interesting throughout this, and even now, as it looks like we're done with the Delta variant and we're moving out of this, is
are we? I don't know. I mean,
I hope so.
I would hope so.
One thing that I found interesting, though, is even as I continue to get new employment agreements or entities or providers that are still hiring people, is that they're still paying them the same. The compensation, at least from what I've seen, is not going down, or at least it doesn't seem to be going down yet. What have you seen on that?
I've seen the comp levels pretty much stay the same or actually increase, simply because the labor market, depending on the position we're talking about, right? The labor market is just not what it used to be.
Right.
It's not what it used to be. So
maybe the compensation can't come down because the facilities are desperate for the staff.
Well, on a different note, but we're going to pivot for a second. You have the compensation model staying the same or can't come down. Now you're reading in the news now about inflation and inflationary pressures. So the money that you're getting paid now is actually worth less.
Right.
And so do you have to do you raise your comp models to meet that? I mean, at what point where does the perfect storm end?
I think we still don't know. I think we really don't. Like you said, on the hospital model, you can only pass off these costs so many ways, and I think they've just been absorbing a lot of them, and I think relying on federal funds to assist with that. But that's another hidden cost. Is a lot of these hospitals have had to bring in evaluators and third party firms to help them apply for these different funds and get these benefits. But then you've got repayment obligations. You've got to make sure that you're valuing your business properly, and that you're not either overstating or understating, because you don't want to be on the hook for something that you're not responsible for. There's It's another hidden cost is, a lot of these businesses that were up and running now, this is the first time that they're reaching out for, federal assistance, and they're being asked for documents that they might not have had, or they're being asked for, reports for things. I think that was one call that I received a lot, I'd say about a year ago, was business coming in and just asking, what is this? They're asking for these reports. We've never done these before. This is the first time I'm having to talk to an attorney because I just don't know what they need at this point.
And we did the last week's episode on EIDL loans,
right,
with Adam. And we talked about that and what is available to businesses from the SBA,
right,
under the COVID EIDL loans. So there are relief mechanisms for that, and I understand where you're going.
Mm-hmm.
I mean, it's some businesses never done this before.
Sure.
So I guess when you look back at the hidden cost of COVID, when you look at it from a standpoint of supplies and excess of supplies, your personnel.
Right.
The inability to generate revenue based on different mandates,
right,
whether it's social distancing or so much capacity,
right, or a vaccine mandate,
or the vaccine mandate. I mean, right now you're looking in the news and you're seeing hundreds of people just not and there's their right to choose not to do this.
Sure.
And getting terminated. And the interesting thing, we did a show on that because we did a show on the OSHA ETS.
Yes.
The emergency temporary standard, which that rule, which was supposedly, coming from the White House's direction on the 100 more employees, hasn't even been written yet.
No. We still don't know what that's going to look like.
No.
So we've got employers preparing for it, but we don't know. And in that standard, like you mentioned on our previous episode, there were so many hidden costs that an employer would have to either, bear the grunt of, whether I believe it was weekly testing for the employees that chose not to be vaccinated. Who would have to pay for that? That's another.
Well, the employer's not going to pay for that. I mean, I think they're going to make the employee pay for that.
But that's another hidden cost. Are you going to increase your employees' compensation or make that come out of their pocket? We've had a lot of employers say that before there was a vaccine that they were requiring testing to come to work. That was another hidden cost that these companies were having to pay for their employees to come into work.
Well, you have a lot of moving parts here.
Right.
You've got think about the fluidity of all the things we just talked about, from PPE, the mandates, the personnel, now the hyperinflation comp model, loss of revenue, and now mandates that could prevent you from hiring enough personnel to run your business.
Yeah, that's a huge hidden cost, and it's not even really hidden at this point. It's that it's going to be a rule.
Not even a cost. I mean, you're talking about possibly not being able to operate. Instead of, like, for example, if you're a hospital and you've got multiple different critical care areas and you don't have enough nurses to run those, you can't operate that because the licensure standards require so many things, so many,
right,
so you won't be able to comply. You'll have to shut that down.
Yep.
And how much revenue are we losing from that?
It could be a big one.
For facilities who are looking at it. So I'm looking at it from a healthcare standpoint, but imagine other businesses who, for various reasons, aren't going to be able to hire staff,
right,
if depending on what they choose. I mean, we haven't even seen the rule yet, but
we don't know it.
We don't know what it says. But
we'll definitely do an updated episode once that rule comes out.
Oh, we're going to absolutely do that. I mean, I can't wait to read it.
I know. I think it's going to be really interesting. There's going to be a lot of back and forth. We're kind of segueing off topic, but I think it's fine.
Yeah.
I'm hearing a lot. Over the past 2 days, I've gotten 2 different phone calls about exemptions from the vaccine mandates. So I think that's
a hidden cost.
That's another hidden cost.
Cost, because, like you said, I mean, the funny you said that. I had a call the other day from a physician client who had a medical exemption.
Yep.
Medical exemption, and sent that medical exemption to a board that
Sure.
reviews these at this facility.
Sure.
And the board is made up of non-medical personnel. That's interesting.
That is interesting.
Some medical, some non-medical, but denied this person's medical exemption. So now the question is, well, what do you do?
And what are the costs associated with it? I mean, we could talk about the costs associated with that, but what do you do if it's...
What do you do?
Is there an appeal procedure in place or any...
Well, we're not talking about medical staff bylaws where we have the appeal process
Right.
on a fair hearing plan, for example. We're talking about someone, I don't know if HRs, that's a good question. That's another hidden cost.
Sure.
Does an HR have a mechanism for employees to send these exemptions in, and if they get rejected, what's the appeal process, and at what point do you stop it?
I don't know what. I think it's so new and it's so fluid that it's just unclear. But you're right. Another cost associated with that is having to put that board together. Meet now. What happens if you lose that physician provider now?
Now you have,
or he decides to sue
Right.
you or sue the entity. It's another cost that's going to come involved for something.
You'll have a maybe an ADA action,
Right.
and an disability action,
Unlawful termination.
You never made a reasonable accommodation, and you never know. But I agree with you. This whole thing has morphed over the last year and a half. Almost 2 years. Gosh, it's almost 2 years.
2 years. Yeah.
2 years.
Yeah.
Yeah, it's been a minute.
Yeah, but you're right. It's changed into, like you said, it's kind of the phrase of flying the plane as you build it or flying the plane as you're learning to. That I think that's kind of what's happening right now is these regulations are coming out so fast and employers are doing their best trying to keep up with them, trying to put it into place. Like in your example, some sort of objective criteria to review these exemptions, but what's the appeal process? Where does it go after that? It's so unclear. Those are, and it all adds in is, everything that's going on related to COVID has a cost. Because there's no manual for this. This has really never happened before, at least that I could think of a good example. There's so many costs involved in doing this, and it's just unclear where this goes.
And also, for that physician client, for example, they're going to have to decide, do I pay an attorney to go file a lawsuit for me against the facility? And what do I do with that? So there's a money factor involved with that. And, of course, on the facility side, we're going to have to defend the lawsuit if one happens. It's just a series of unfortunate events. And I think you're right. Everyone's learning on the fly.
Yeah, it really is. It really is.
So I don't know where this goes.
I don't know either.
I would love to see the books from a facility to see
Sure.
the variances in supply side,
Absolutely.
materials management side, and especially so environmental and nursing. I mean, your biggest expense in any business is your personnel, and that's so true in facilities. So I would love to see what are the expenses we are incurring as far as nursing goes,
Right.
and environmental goes, because to me those would be the two major ones that I would look at on the COVID side, just because of what we're seeing.
Yeah, I mean, those had to have shot up during this.
Yes, absolutely. So we're gonna have to. I guess we're gonna have to figure this out. But definitely there's a lot to think about when you're thinking about the hidden cost of COVID. All of those things come into play for any business.
Yeah, and they've all impacted in the full spectrum of businesses, and like we mentioned, there's been government help and government assistance, but that can only go so far and last for so long. And I think, fortunately and unfortunately, some of these hidden costs that businesses have incurred, might become requirements now on where restaurants, I don't know, it might not, but there could be requirements to keep these changes in place where things have to be cleaned at a higher frequency and that kind of thing. So we'll see.
Well, great. Well, listen, thank you very much, Rory, for bringing this topic to the forefront today.
Thank you.
We appreciate that. And listen, for everyone who is a listener here, we really appreciate your continued support of the podcast. And if you like what you hear, please make sure you subscribe to the podcast. And if you have a comment or a question, you can always email us. We're pretty easy to find on the website, www.shahardi.com. And you can find Rory Bellina, Conrad Meyer there. Email us, drop us a line, tell us how you feel. But again, we look forward to our next episode next week. So everyone have a great weekend, and thanks for spending time with us, and we'll see you soon.
Thank you for listening to Health Law Talk presented by Shahardi Sherman Williams. For more information or to contact us, please visit our website linked in the description below. Also, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube linked in the description below. Thank you for listening.